some people don't wash their face. And I learned that a lot of people just, after their day, they just go to bed. But we have all the pollutants in the air, oil production, whatever you put on your face. We touch our face during the day. All that has to be washed off. If you're not washing your face at night, that can set you up for acne. Another thing is making sure you're changing your pillowcases regularly. Those things get all the stuff from us on them. And if they're collecting oil, you put your clean face on a pillowcase that hasn't been washed in 2 weeks, then that might set you up for acne too.
I'm not afraid to write a brand new story. And what changes find their way to me, I can keep it moving. I'm not afraid to celebrate my glory. And when challenges grace my path, I know I can face another day. Inside, I rise, daring to learn. With Fox After 40.
What's up, you guys? Welcome back to Fox After 40, where we focus on all things women's wellness. And today, I have an exciting guest for you. All right, we're discussing acne after 40 with Dr. Aleta. But before we get into that, I want to go ahead and read her bio, okay? Dr. Aleta Simmons is a board-certified dermatologist based in Nashville, Tennessee, dedicated to advancing skin health and equity. A graduate of Loyola University, Chicago, Stritch School of Medicine, she completed her dermatology residency at Case Western Reserve University. Dr. Simmons formerly served as an assistant professor at Vanderbilt, where she was recognized as a Fleming Scholar and diversity champion. Her clinical focus includes acne, hyperpigmentation, and procedural dermatology with a passion for addressing health disparities. Through her company, Get the Skin E, she educates communities via speaking, writing, and workshops, and is the owner and founder of Simmons Skin Center. Outside of medicine, she enjoys exploring Nashville, traveling, and spending time with her dog, family, and friends. She also has an educational platform called Get the Skin E and is a co-host on the Gorgeous Plate podcast. I got that right?
Yes. I didn't realize that was in there twice, though. Get this skinny.
It's okay. Well, welcome to the show.
Thank you for having me.
Oh my gosh. So I know I just gave the whole deep background, but if there's anything that you want to sum up so that we remember, feel free.
I don't know if I would add anything.
Okay. I love it. All right. So today we're talking about acne after 40, which you have no acne. So you must have all the tips. Is this genetic or no, girl, I know what I'm doing?
I did grow up with acne when I was maybe in 8th grade, some through high school as well. But my mom took me to a dermatologist and my skin got better. I used a retinoid, if anybody's ever heard of tretinoin, which is a common one. I was on that for years. And my skin pretty much did well. My mom has great skin, so there is that genetic component in there. Now that I'm after 40, I do occasionally get a bump here or there. But because I'm a dermatologist, I know what to do with it.
So can you explain to us what is actually happening with acne? I know we know it as bumps on our face, but I feel like there's an actual medical terminology that we're probably missing on what acne is.
When people think about acne, they typically think of teenagers, but we can get acne at any age. A lot of the patients that I take care of are 40 and up. Some of them have acne for the first time and they don't know why. Acne is hormonal, all of it. Teenagers get it because their hormones are rising and they're going haywire. And hormones affect the sebaceous gland where we get oil production. They live in our follicles on our face. We can also get acne on the chest, on the top of our arms, and on our back. And those hormonal fluctuations, especially after 40, can cause people to have acne too. So we have both ends of the spectrum. But then we also have people in the middle where their acne never really goes away. They kind of have it lifelong, especially if they're not on any treatment. So we have to think about treating the hormonal component of acne. But then there are also bacteria that live in our little hair follicles, and that bacteria can kind of go off course. And when it does, it can cause acne in the hair follicle.
Is there a particular hormone that causes acne, or is it just all of it?
When we think about acne, we think about estrogen and testosterone. usually the estrogen fluctuates in our lifetime, but in our 40s, our estrogen starts to drop. But then we still have androgens. Think of an androgen as like testosterone. And when that's high, testosterone can bind to our hormone receptors that we have on our skin and in our hair follicles. Women over 40 are going to experience acne and hair growth on the chin and on the cheeks, so that lower face area where more of those hormone receptors are. And then on the scalp, they may have hair loss because on the scalp, the testosterone is broke down into something called DHT, and that is binding to the hair follicle, causing it to shrink, and then the hair comes out.
Right. And I'm familiar, and we did an episode on hair loss too. So,
nice.
So if you guys have questions about hair loss, definitely go back to the episode. But as far as acne goes, so it's the decrease in estrogen that's causing the acne?
It's more of
or the increase in testosterone.
It's not increasing per se, but it's not opposed. Think about opponents. You have estrogen and testosterone. When they're equal, they cancel each other out. But when the estrogen drops and you have more testosterone, there's no balance in that. And because of that lack of balance, you have more binding to the hormone receptors on your skin.
How do you know your acne is worth doing something about? Right? Like I might have a bump or two. So for me, I think it's hormonal acne. I get it every time it's the week before my cycle.
Right.
And I get a few bumps right in the perimeter. You know what I mean? I get like 3. And sometimes it scars and leave a mark, sometimes it doesn't, right? And I end up putting like hydrocortisone on mine, which I don't know if it's a bad thing, but it reduces inflammation. You know, acne is inflammation. I'm trying to reduce it, so I just put hydrocortisone on there.
Okay.
And sometimes it works, sometimes it doesn't. But then after my cycle comes, I'm good, but now I have these bumps, right? And I'm like, should I have seen a derm for something like this? Is this worth seeing a derm for? Or is it more so like when you have like chronic, where it's like, I don't know, you may have 10 bumps or you have like a ton of scarring, or like what's worth seeing a dermatologist for?
I think it depends on the person. I have patients who have a similar story like you. Their acne is mild and around their menstrual cycle, but it really bothers them, or it's leaving those dark marks behind, or what we call hyperpigmentation. And I say, if it's bothering you, come in for treatment, especially if it's leaving behind scarring, because scarring can be permanent and last a long time. I have patients that had acne in their teen years, and they're still trying to get rid of their acne scars today, and it might have been 20, 30 years ago.
Wow. What are you recommending? Oh, I have so many questions. For treating the acne, but also for that scarring.
We have 2 approaches. Some people want to start with something over the counter. So we have that conversation if they want to stick to over the counter treatments before they jump into prescription. There are lots of great products now over the counter. I say start with your wash. If you have skin that's not sensitive, you can use most things without them causing itching and burning or too much dryness. You can start with products that have salicylic acid or benzoyl peroxide in them. That's a good base for a wash for acne. And then adapalene is over the counter too. It used to be prescription strength, but now you can get it anywhere. And
is adapalene on the bottle?
It may or may not be. Generic versions, it's going to say adapalene on the bottle. But there are brands that also make it, so their brand name will be on there. And it'll say acne treatment, but when you look at the active ingredients, it's going to say adapalene. And using that at night can be helpful. And particularly in brown skin, I tell people to start slow. Because retinoids can be really drying to the skin. And if your skin is dry, it can become irritated. Irritated skin turns red, and then it leaves you with a dark patch. And we don't want that. So I tell people to start 2 nights a week for a couple weeks, and then go up to 3 nights a week. Once their skin gets used to that medication, you can start trying to use it nightly. But if you only use it like 4 or 5 nights a week, or even 3 nights a week, that's fine. You're still getting the benefits.
What is the consistency of the adapalene or whatever it's in? Is it a cream? Is it a spray? Is it a liquid?
It's a cream, but some of them almost feel like a cream to gel base.
Okay. A cream to gel base. Okay. Is it spots, or is it like the whole face?
I tell people to treat the whole face, and you want to use a tiny amount, like a chocolate chip size or a green pea size amount for the whole face. Take that on your finger, dot it on your cheeks, forehead, nose, and chin, and then rub it in. Don't get it really close to your eyes, corners of your nose, or the corners of your mouth, because it can make those areas a little irritated.
Yeah. And so we're looking at, so you have the acne, you have the wash that has the salicylic acid, and what else was it?
Salicylic acid or benzoyl peroxide.
Or benzoyl peroxide. Clean the face. You put this cream on, a chocolate chip size. What are you following up with? Like, are you having to do like a moisturizer or?
Absolutely.
Okay.
A moisturizer at night. And then don't forget the sunscreen during the day. Because if you have dark marks associated with your acne, you want to protect your skin because the sun can make those dark marks darker or just interfere with your treatment. You're trying to lighten dark spots, but the sun is going to make them persistent. So adding in that sunscreen is really important.
You know, it's so funny. I was staying in Merida, Mexico for like a few months last year, and I was walking every day. I don't know if you've ever been to Merida, Mexico. It's like basically it's in between Cancun and Mexico City, right? Like a couple hours apart. When I tell you the sun was blazing,
I'm sure.
You pop out the house for 5 minutes, you're sweating. You're like you're sticky, and I would go on an hour-long walk. And I didn't, after I was, I had my little sunscreen on or whatever, so my face, I mean, I lied. Some days I had my sunscreen on, but eventually my lips started to look black, like I smoked, like right up in here. And I'm being like, and then I had like a black patch on my lips for like a month or two. And I'm like, I don't know what this is. And like, it wasn't as irritated, but it was sunburn. I had sunburn on my lips. I didn't know you could get sunburn on your lips.
Absolutely. My first sunburn was on my lips.
Really?
In high school, and it was awful.
What were you doing?
Just outside.
Oh, wow. I didn't know you could
outside
get
all
that.
day.
And I was trying to scrape it off. It did not work. I had to just let it naturally heal and just go away. It took like 4 months. Everybody was like, what's on your lip? I'm like, I got show for work and stuff. And like, even if you put the lips in, it was like right in here too. Anyway, I digress. Sunscreen. You need your sunscreen.
That hydrocortisone you have too would have helped.
Oh, really?
Just applying that twice a day for a few days would help that inflammation clear up.
I can put it on my lips?
You can.
Just be careful. Don't like, well, it's not.
It's a small amount.
Okay.
You're not going to be eating that much of it.
So some people say, no, hydrocortisone is like steroids and you shouldn't put it on your face. If you've gotten any value from listening to Fox After 40, you learned a beauty tip, you've gotten advice, you've shared the episode with a friend, please do us a favor and leave us a review on Spotify and Apple. It goes a very long way in helping us continue to build the podcast. Thank you so much, and I'll see you in the next episode.
With instructions, you can.
Okay.
I have many patients that have skin diseases that affect the face, and steroids, even stronger than what's over the counter, can be used on the face. And then the lips are different because we call them mucosal surfaces. They're a little bit different than the rest of the skin, and they can tolerate steroids more because the skin is shedding more.
Can you put hydrocortisone on like dark marks? Will it do anything or no, not really?
I do it in combination with other medicines. If someone has dark marks, I'll do a retinoid with a medication called hydroquinone plus a steroid. It tends to work better. Those two medications are irritating, and the steroid kind of combats that irritation. And those three medications together help treat dark spots pretty well.
Wow. Okay. And so you say it depends on the person or whether or not they need to see a derm for their acne, right? Are there things that we could be doing that we don't know are making our acne worse?
Oh, absolutely.
Like what?
I say if anybody has acne, they should come see a dermatologist just to get treatment, even if it's over the counter or prescription. But just simple things at home. Some people don't wash their face. And I learned that a lot of people just, after their day, they just go to bed. But we have all the pollutants in the air, oil production, whatever you put on your face. We touch our face during the day. All that has to be washed off. If you're not washing your face at night, that can set you up for acne. Another thing is making sure you're changing your pillowcases regularly. Those things get all the stuff from us on them. And if they're collecting oil, you put your clean face on a pillowcase that hasn't been washed in 2 weeks, then that might set you up for acne too. Another thing for women, I always talk about how they wear their hair. If someone is wearing their hair and it drapes their face, the oil or the products that you have on your hair transfer to your skin, and that can definitely cause breakouts. So those are some simple things. Wash your face twice a day. Use a moisturizer based on whatever your skin type is, whether you're oily, balanced, or dry. And then the things that are touching your face, make sure they're clean.
What about like inflammatory foods, like
that's
milk,
a good one.
Things like that?
Milk, I have a lot of patients, especially teenagers, will say they find when they drink dairy, it makes their acne flare.
Yeah.
But in research, the jury's still out on if it definitely does. Some studies say yes, some studies say no. But what we do know, we call it foods with a high glycemic index. Sugary foods, all the things that taste good, right? Bread, cake, cookies, chips. things that are high in sugar definitely make acne flare because sugar is inflammatory. It's going to make any skin condition worse. So I always talk to people about what they're eating and around the flares. Like some people say, I've just really had a bad flare. I go back to diet. Were you stressed during that time? Was your diet the one where you reach for the fast food? Because then that might be contributing to why you're flaring.
And I was like, oh, well, milk is giving me these flare ups, so let me switch to oat milk. And then I switched to oat milk, and then I learned that oat milk was worse. And I learned that oat milk is actually that's based in like rapeseed oil is highly inflammatory. And so, and often it can be worse for you than just regular 2% milk. So then I went back to 2% milk. And then I realized, honestly, when I was not drinking any of this and I was just drinking water, my skin was the best. And I was like, okay, how do I get off of all of this? No more lattes, okay? Black coffee only. So yeah, that was a lesson that I had as far as inflammatory foods go. So are you doing, you were over the counter is how we're treating acne, right? But does that not work for some people?
It doesn't. Some people need more things, right? I tell people we have a toolbox in dermatology, and sometimes we have to mix it up. If what's happening what you're using over the counter isn't working, then we need to talk about everything. I do something comprehensive. I want to know everything somebody's putting on their face in the morning and at night, because it may be something that you're using that's driving acne to just be persistent. It may be an oil that you're putting on that's clogging your pores. So I start there. What are you using? And then I usually will take their list and take things off the list and tell them what to keep. And then we add in medications. And that could be oral antibiotics for people who have moderate to severe acne. Though, the pustules people get, those kind of pink and white bumps, those typically need something more for them to calm down. Or other topicals, topical antibiotics, the topical retinoids, even oral retinoids can be helpful. And we just do a combination to see what works. But I meet patients where they are. Some patients may want to start, simple. I can't add too much to their routine because they won't do it, right? You want people to be consistent with what they're doing. And if I give you 3 medications and you're not going to use any of them, it's not going to be helpful. So let's start with one. And then some people want to be more aggressive. Give me everything at one time. So then we may combine a combination of medications, but also chemical peels or microneedling and laser treatments, especially if that hyperpigmentation and scarring is playing a role in their acne.
My next question is about body acne. And I noticed, and I don't know if this is real, but do men have more body acne than women, like around their shoulder and back area?
I don't know if they have more, but it's definitely a common complaint, especially if people are playing sports and exercising. Because people exercise, get sweaty, and then don't take a shower right afterwards. So the bacteria and sweat is clogging the pores and can lead to more breakouts for people. Or it's just happening as part of their acne, right? It's just part of their acne story. I just saw a teenager in the clinic and he played football. So in addition to having hyperpigmentation in a pattern from his shoulder pads, he was also having hyperpigmentation from his acne, but he wasn't correlating the two. He was thinking that he just had dark marks and didn't know where they came from, but he was actually having active acne breakouts. So we went through a whole regimen of how to take care of it and to cleanse the skin and what to cleanse his skin with.
Did you give him any medication or anything, or no, it was just take a shower?
No, I gave him medication.
Oh, okay. I'm sorry. I feel like when I talk to all the OB-GYNs and all the primary care physicians, their answer to everything is eat well and exercise. And for derm, it's take a shower, wash your face, wash your body.
Yes. Listen, I've been prescribing people baths lately.
I'm not mad at it.
Yes.
Do you ever recommend? Now, look, I love a good bath. Are you recommending a certain kind of bath with certain things in it? Like, are we talking milk tea baths? Are we talking like?
I just want them to wash. Get some. Just get some sensitive, fragrance-free soap for the shower, and make sure you're doing it regularly. If people come in and they say I'm only taking a shower once a week, I say, can we go to 3?
No, you don't. You don't have no patience saying they take a shower once a week.
I absolutely do.
And they say that with confidence.
Absolutely. I had one patient tell me, he said, I know this is weird, but I shower every day. I said, that's not weird. That's normal.
What are y'all doing? Are y'all showering daily or weekly or monthly? No. Well, I'm so curious. Why did the person want to shower once a week? If you've enjoyed this episode of Fox After 40 and want to get notified about the next episode when it drops, make sure to go to CurlMix.com and sign up for our mailing list. We'll notify you whenever a new episode comes out.
I think one was age, and then that's just what he was used to. Some people don't shower regularly, and that's just common for them.
I understand it. I could see going a day, like a day or two. Like I could see you doing like, okay, I showered on Monday, couldn't get to it on Tuesday, so I showered on Wednesday. But you waited until Sunday for your next shower?
Correct.
Okay.
I don't agree with that.
Yeah, but
people do it.
And that's I can understand doing it if it's just your circumstance. But your preference? That's interesting.
Yeah, it's a choice for some people.
And you would definitely get acne from that. Okay. I'm going to stop on it. You blew my mind right there. Yeah. Oh, my goodness. Okay. So we talked about salicylic acid and talked about, or the benzene.
Benzoyl peroxide.
And then we talked about the retinoid, a cream with the retinoid.
Yes.
For the dark marks.
And acne.
Yes. And then a moisturizer, which, I mean, that can just be general. It doesn't have to, do you need any active ingredients or no?
It doesn't have to.
Okay.
Sometimes we do moisturizers with active ingredients.
What about those vitamin C serums that I see everybody having? They always look cool. I always buy them because I feel like, oh, this feels like I'm doing something. Is it really worth it?
Not for acne treatment. Vitamin C is an antioxidant.
Okay.
And it's good to use in the morning if you want to. It can help brighten the skin, but it also protects your skin from the pollutants in the air.
Yeah.
I would think of it like a barrier protection.
The cream you use, does it need to be the sunscreen, or it can just be a regular cream and the sunscreen goes after?
In terms of your moisturizer, there have been some studies showing that it's more effective to use a moisturizer and then use your sunscreen. A lot of times now sunscreens are formulated for the face with moisturizers in them, so you may not need an extra moisturizer. If your skin is dry and you're on a retinoid, you might want to use a moisturizer and a sunscreen. So it just depends on what's going on with your skin and how it feels. It's I think skincare is very personal. There's no one size fits all. And I kind of talk to people about how they feel, if they feel overwhelmed by products. And we try to keep it simple. Just wash your face and use a sunscreen that's also a moisturizer.
If you're naturally oily, or let's say your skin is naturally dry, which is unusual, I guess, for like Black people, but are you still acne prone or no? Not really. Your skin is just dry. You can be?
Yes, because there's still bacteria that live in your hair, in those follicles or those pores that can drive acne and the hormones. It doesn't have to be just from oil production or oil clogging the pores.
Okay, so tell me, is this a bad idea to like, you know how they have like those pimple popper metal pieces that you can buy from Amazon? It's like
those extractors?
Yeah, the extractors.
Don't do it.
Don't do it. Oh, I be doing, maybe that's why I had dark marks. So you just let it just be big and white on your face until it goes away.
Just let it live. It can still leave a dark mark by itself, but if you start manipulating it or touching it, squeezing it, poking it, it can definitely leave a scar, like a dark mark. But you also have to think about acne can leave deeper scars where the skin is damaged. Your epidermis, or that top layer of the skin, can be removed from manipulation. And if that happens, then you have a scar that is going to be really difficult to improve.
Does exfoliating take a part in like acne prevention or care? Exfoliating your skin on your face?
That can be tricky.
Okay.
You may or may not need that, but I call retinoids like peels in a bottle because they help with cell turnover, which is what exfoliation does, removing that dead skin that's there, helping it come off. And if people want to use exfoliation, I tell them to use like something gentle. You know, back in the day when the apricot scrubs were popular, the rough, gritty. Yeah. Those can cause micro tears in your skin. So if people want to do some exfoliation, especially as you get into your 30s, 40s, 50s, and beyond, those that I like are like lactic acid, mandelic acid, glycolic acid. They're really going to help with exfoliation, and then using them, I would say in between 1 to 3 times a week. If you're dry, I would say once a week. But if you tend to be on the oilier side, you can do 2 to 3 times a week. Some of them are formulated to use more often. Yeah. But I think that would be when I recommend an exfoliation.
What about the peels? I've seen several of my friends, I mean, they be looking scary when they get them too, Yes. But their skin does look glowy after. And have you ever done one before?
I have.
Really? How many? Often?
Me, personally, or performing them?
Oh, both. I'm curious.
I do chemical peels all the time for people. I've done peels on myself a couple times.
Okay.
Yeah.
And you say,
I love
when was
them.
the last time you got it?
The last treatment I had was a laser treatment about a month ago. And I think I had a peel maybe 3 or 4 months ago.
Oh, okay. So you get them regularly then?
I don't.
No.
I am low maintenance.
Okay.
I wash my face, sunscreen, and a moisturizer. If I add anything else, I'm in the mood to do a little razzle dazzle. But I'm more on the low maintenance side. I've been trying things out because I want to try what I'm offering to my patients too.
Gotcha.
But I don't do a lot to my skin. I keep it simple.
What was the experience of the peel for you?
I use a peel that's more non-inflammatory.
Okay.
So the experience that you see on TikTok and social media where the skin is just peeling and people want to cut it off in sheets, I didn't have that experience.
Okay.
I used one that was more gentle. So you may feel like dusting on the skin. Like I know like some skin is coming off, but it's not, dramatic.
Yeah, I've seen it. It's scary. It's like a snake skin or something like that coming off.
Yes.
How long does it, so what is the process of a peel?
The process?
Yeah.
It depends on which type you get. But usually peels are applied to the skin after it's been cleaned. We usually remove the oil with like an alcohol-based wipe or cleanser. And then the peel is applied. Depending on if you've ever had a peel before or your reaction to a peel that you've had, you may be on the light side in terms of how many passes. When I say passes, I mean how often it's applied. So you apply it once. Some peels the medication can be applied, 3 or 4 times. But if you've had a bad reaction, you want to let the person know before they do a peel. But after that, if it's a peel that doesn't need to be neutralized, kind of like we had to neutralize perms back in the day, if it doesn't need to be neutralized, you're done.
Okay.
We will apply sunscreen and you're out the door. Some of them need to be neutralized, but that's a simple process too. And then sunscreen and you're out the door.
And how long are you peeling for?
I would give yourself, depending on the type of peel, 3 to 7 days.
Okay. And do people typically do this if they've had like difficult acne in the past and they have a ton of scarring and they do a peel and it like removes all of that?
It doesn't remove it all the way. I tell people you might need at least 4 to 6 sessions before you get to where you want to go. And you may have to add other things in there, especially if you have, the scarring that looks like little picks, like you have indentions in the face or they're like square. Those type
I've seen those. Mm-hmm.
Those type of acne scars take more different types of treatments in order to improve.
So I should consider a peel if I want to get rid of like my dark acne spots. Well, I could try retinoid first. Retinol. Or
that combination cream we talked about before. Mm-hmm. There are some good over-the-counter products for hyperpigmentation now, just depending on how severe it is.
Yeah.
You could do a series of peels. Sometimes if you do microneedling and with a peel.
Now that I'm scared of, the microneedling. Because I
love to do it.
You love to do it?
I do.
Why?
One, it's easy, and the after effects are nice because your skincare products are going to penetrate better because you're basically making micro pores into the skin.
So that it can actually be more effective.
Correct.
So people come into your office to get the micro needling done. Okay. How long does it take?
The numbing cream probably takes longer than the procedure. People have numbing cream on for about 20 minutes, and then the procedure it's pretty quick. And then probably 15 to 20 minutes.
And then when do they see the results? Like of, I guess, clearer skin, essentially, is the goal, correct?
Correct. Mm-hmm. It depends on how severe it is. Some people will notice some effects after a few days, once their skin kind of is healing over and they're continuing their skincare. But for scarring, it can take multiple sessions to really get that to improve.
This is so helpful. Thank you. Can certain acne treatments worsen hyperpigmentation?
They can if they are irritating. Like we talked about before, if your retinoid is causing you irritation, or if you're using a retinoid, benzoyl peroxide, and salicylic acid all together, you have the perfect storm of having irritated skin, and any irritation on brown skin can leave behind dark marks.
Okay. What are some common myths about adult hyperpigmentation and or acne that just are not true?
I think one myth is that the fact that I think one thing that's important to think about is that adults do get acne because insurance companies don't cover acne medicine sometimes for adults because they think that it's a teenage issue when people can have acne long term. So I think that's a myth that adults don't get acne.
They think your time to procreate is teens and 20s and 30s, and after that, we don't care how you look. Okay, we only doing stuff that's related to death. That's crazy.
Yeah. Or the acne will just pass, right? It's just something that's happening and then it'll go away. Acne needs treatment in order to go away.
Absolutely. Oh my goodness. That's what of course, why is my acne medicine not covered by my insurance? Healthcare in America. What are some tips for applying our makeup that we can use to avoid irritating and making our acne worse?
That's a good question. One, you want to start with a clean palette. Going back to cleansing the face twice a day. Before you get makeup, you want to make sure your skin is clean. And also prepping the skin, applying a moisturizer, just in case some of the ingredients in the makeup can be irritating.
What about, like, I use primers, and primers have silicones in them.
Okay.
And that's how you get the flat, the beat, okay? Like, you get the flat surface on the skin, and everything's even, and, like, you look poreless. You need a primer with silicone in it. Silicone is plastic. Right. And so I've always wondered if that makes my acne worse. You know what I mean? By applying it. I also know dirty brushes are really bad too.
Yes, because what do they have on them? Bacteria.
Right, exactly. And some people, I mean, like, I know people went a year without cleaning their brushes, you know?
Yes, and that can make people more acne prone. So making sure you clean your brushes, making sure your skin is clean. The biggest thing is making sure you take off the makeup at night. That's what I find. People are like, I get tired, I just want to go to bed. I left my makeup on overnight and I woke up with breakouts or my acne was worse. Or they did it over the course of a couple days and now they're flaring. That makeup is just going to sit in your pores and cause irritation.
I've done that. Might do that once a year. It's not on purpose. I have to be
like a New Year's Eve.
Right. I'm real gone. I had like 8 shots or something. You know what I mean? To the point where I'm just lucky I made it in the house.
Like,
and I'm in the bed. Exactly. And I'd be like, oh, I didn't take off my makeup. But then you clean it. It's like, it wasn't that much to take off anyway. So it transferred all throughout the night. But other than that, I am very diligent about taking my makeup off at night. Just because it's harder to get rid of the acne. It's easier to prevent it. So that was my lesson there. Is there anything you want to leave the people with about acne over 40?
Yes, there is hope. Don't get discouraged. If you're doing all the things at home and it's not getting better, it's time to come in to see a board certified dermatologist.
Go check her out, y'all. Where can they follow you?
You can follow me at Get the Skinny, GETTHESKINE. You can also see me over at The Gorgeous Plate for our podcast. And then if you want to follow the clinic, you can follow the clinic at Simmons Skin Center. And we're on all platforms.
Check her out, you guys. I learned a whole bunch in this episode, and I will be applying these tips to get rid of my dark spots. Make sure you like, comment, and subscribe. Leave any questions you have for Dr. Alita below. And definitely check out CurlMix if you're looking for any kind of hair care products to nourish your hair. All right, I'll see you guys in the next episode. Peace.